Should you expand your office hours, maybe add some evenings, possibly a Saturday? Well, that's what I want to talk about in this week's tip. Whether or not to expand office hours is a question that we get pretty frequently, especially from newer clients. And in many cases, newer clients come into MGE already working a lot of hours. And the idea of expanding hours when they first showed up was, if you need to add more patient availability because it's what patients want. Yet the problem is the hours they'd like to be working are already not busy enough. So then they've added other hours because, again, this is what patients want, and then they find that they are generally miserable. So I guess the first answer to this question is if you are not busy enough during the normal hours that you should be working, then I would say don't expand office hours unless you hate yourself. I mean, if you really hate yourself, you could expand your hours and join a bunch of HMOs, and why don't you cut your fees by 50% at the same time? There's really absolutely no point in it. Now, when should you add hours or expand your hours? Well, there's a couple of basic situations here. Let's take a look at how you're structured to begin with. Ideally, you want a 40-hour-a-week office, but I don't necessarily mean 40 clinical hours because you have to account for time with your employees and your team to show up, to open the office and to close the office, as well as any training or meetings that you want to do around clinical hours. So if you have a 40-hour week with, let's say, 32 to 34 clinical hours, that tends to work. That gives enough time for opening and training and things like this. If you expand to 5 days a week or 5.5 days a week, a couple of problems begin at that point. If you had a team of, let's say you had 3 people at the front, 2 or 3 dental assistants and 2 hygienists. Now, in order to account for that, you have to sort of spread people out a little bit because now they're having to work more than 40 hours. So you're either going to be paying overtime or you're going to be spreading out your team. As a matter of fact, we had a client years ago who's very successful now. And he asked me about this because his office, when he's new to the program, his office was open 5.5 days a week. So when I started to ask about various functions in the practice, I noticed that certain people weren't there at certain times, again, because of this hours issue. So what do? We condensed it down to 4.5 days a week. That gave him time to have the entire team there at the same time without having to pay overtime. And maybe it's not an apples to apples comparison. Imagine trying to play baseball and you're fielding your team and you're missing your third baseman and shortstop. That really doesn't work. And for non-baseball fans, I'm sorry. But again, you wouldn't even be able to play at that point. But the point being is you don't have the car firing on all cylinders. It's not running properly if you don't have everybody there at the same time. Now, let's say you're doing a big case on a Friday morning and that's a time when your office is not normally open. Sure, you're not going to have your entire crew there for a Friday morning. It might just be you and your dental assistant because that's all you need. But that's a bit of an exception to the rule, right? So, if you want to run a normal schedule, you're open from 8 to 4 or 9 to 5. We have a lot of clients that do this 4 days a week and maybe a half day Friday. That works. You're within that 40-hour limit, and everybody can be there, and the whole team is present and doing what it is that they're supposed to do. Now, when would you want to expand beyond that? Well, it has to do with 2 things. One, it has to do with your facility and your volume. If, let's say we have a 4-chair practice, and the practice is open Monday through Thursday from 8 to 4, and on Fridays from 8 to 12, and it is packed. You can't fit anybody else into that schedule. And that's assuming your schedule is being done correctly. You're not scheduling linearly. You're double booked properly. Maybe you got 2 hygienists in the 2 other chairs and you're running room to room and you're very efficient and you're very productive. We have a couple decisions to make at that point. You could expand hours, which wouldn't necessarily mean you expanding hours. It might actually be adding a shift, which I'll talk about in a second. But let's say the other option, you got 4 chairs and you have room to add a 5th or a 6th. Add chairs and keep your hours the same at that point. Get more providers, get more employees, and the place will be more productive in that 4.5 days. And again, the entire team is there. If you have an associate that you've brought in, you're around for the associate. But let's say you got 4 chairs. You cannot expand beyond this if you wanted to. You're running at maximum efficiency. You're massively productive. Well, then what would you do? You might add a second shift. So your first shift runs from 8 to 4, right? Run that first shift a little earlier, 7 to 3. Then you might start another shift from 3 to 7 or 3 to 8. You might do that 2 days a week to start. Eventually, it'll be going for 4 or 5 days a week. Who's on that shift? It's an entirely different team. You might have a junior office manager running it because it might start slow and then eventually build up with an associate doctor. It's not you, the owner doctor, who's then having to work 60 hours a week. That makes absolutely no sense, especially if you're super productive within that 4.5 days. So that's really the only time I would expand hours. I wouldn't expand hours if I was not busy enough within the hours that I'm working. Sure, if you want to accommodate patients here or there, you could have one evening a week that you work, or maybe one Saturday a month if you feel really that that's important. But again, I've seen people get crazy with these Saturday appointments where, Saturdays are sacrosanct, and if I'm open Saturdays during the summer and a patient misses their Saturday appointment, they never get a Saturday appointment again. Why are you doing this to yourself? There's really absolutely no reason. So, summary, don't expand your hours unless you're busy enough within the hours that you're already working. And those hours should actually work for you as the business owner and contribute to your quality of life in a way that you find that makes you happy, okay? So that would be my answer for that. If you have any questions about things like this, you can always contact us here at MGE at 800-640-1140 or find out more about us by going to mgeonline.com. And don't forget, if you'd like to see more tips like this and be notified when they come out as they are released, don't forget to subscribe to the channel and hit the notification button so you know as soon as we release a tip. Folks, have a great week, and we'll see you at the next tip.